Hello, my name is Ernest Mitchell,
And I'm Lauren Mitchell.
and this video is going to be about health insurance. We are inside the house because of the coronavirus pandemic, but we wanted to talk a little bit about health insurance. There's a lot of people that are underinsured or underadvised when it comes to health insurance. So, number one, if you don't have health insurance, you need to consult a broker. We would love to be your broker, but if not us, find someone else, because this is not the time that you want to go out there and put yourself and your finances in jeopardy without health insurance. Number two, if you do have health insurance, there's a possibility that there might be some things that we still need to talk about, because I see a lot of people that have really high deductibles, and these people are not familiar with something called gap coverage. And what gap coverage covers is the first dollar to whatever the deductible is, or you can even make it higher than deductible for your first accident, sickness, inpatient, outpatient, or critical illness, which covers like heart, stroke, stuff like that.
Yeah, so what we've been finding lately is that there are a lot of people who think that they're in a certain plan or have a certain type of plan, and once we get talking to them, we find a lot of holes in it, or we find out that what they think they have isn't what they actually have. So we're able to really assess the situation and offer some guidance and offer some additional tools that are going to give them a full-bodied plan. Really important, especially during this time.
Another thing too, when it comes to health insurance, we don't bite. So the first conversation is really us and you having a conversation, so we can see if there's any value, if we can add value. At that point, we're going to compile and put some quotes together based on what we feel mutually that's going to benefit you, and we'll email them to you. Then we'll set up a time to where we can follow up. It's that simple. I tell people all the time, if you don't feel like this is of value, then don't answer our call, or tell us not to call, whatever.
That's right. If it doesn't make sense, it doesn't make sense. We want to, what we are bringing to you has to make sense for all parties involved. And if it doesn't, it doesn't. There have been plenty of times where what we have discussed doesn't make sense for that person to change at that time, so they stay. But then on the flip side, there's a lot of times where we are able to bring something else to the table to add value to that person.
Yeah, and all we need is your ages, your email, and sometimes we're going to ask some questions about your pre-existing conditions or your health, but there's no reason to not at least do an analysis, especially with this pandemic going down. Not to try to use the coronavirus as a way to sell insurance, but we just want to inform people.
Mm-hmm. I think that what we're experiencing right now with this pandemic, it's been very eye-opening for a lot of people, because no one is immune to this. This can strike anyone, anytime, anywhere. And if you don't have that health insurance, it's going to be really difficult financially. It can be a really big burden on your family. And it's not just that out there. We want to make sure that you're protected for anything health related.
I'm Ernest Mitchell.
And I'm Lauren Mitchell.
We're the Mitchell Brokerage. If you need to reach us, you can reach us at 1-800-615-1440, or send us an email, Ernest or Lauren at mitchellbrokers.com. Love to meet you, chat with you. Have a good day. Yep, bye.